I grew up in the upper Ninth Ward on Muro Street, 3137 North Muro. I still remember a lot of musicians that were living in that area. You walk down the street, you might hear Roosevelt playing on the piano. You go the other way, you hear the trombone playing, Mr. Johnson playing, and Frank Parker beating on those drums. So I grew up around it, and I was just attached to it. I started playing at the age of 8. I took my first professional job at the age of 13. I played for 5 U.S. presidents. I played for the King of Thailand. I played for the Queen. Right now, I play for 2 churches on the weekends. I play at Preservation Hall. I actually work 7 days a week and 5 nights. When the doctors came back and told me I needed to have bypass surgery, I said, this is impossible. I don't have any issues. I don't have any shortness of breath. As I put it, I was a walking dead man. My wife and I, in 2023, November, we had planned a trip. It was a cruise. We were going to drive down to Galveston and tour the Western Caribbean. It was time for my checkup with Dr. Lambert. Everything checked out fine. My numbers were pretty good. He said, because of your age, you might want to get a coronary artery scan.
When I first met Rickie, he was feeling well, didn't have any symptoms, and he came with diabetes, with high blood pressure. He really shared how much he loved playing music and just, traveling and spending time with his family, and we wanted to extend that time to the most that we could. And we really talked about a calcium score, which shows that there's plaque in the artery. And when we got the calcium score back, it came very high, over 1700. And so it showed extensive plaque in the arteries. And so we got him connected with a cardiologist very promptly.
And I talked to Rickie. Rickie's totally asymptomatic. Doesn't have chest pain, doesn't have shortness of breath. So I wanted him to have some more testing done and arranged for a nuclear stress test. The nuclear stress test was markedly abnormal. So I arranged for him to do an angiogram as soon as possible. An angiogram demonstrated multiple blockages in his heart.
Then he started giving me the percentages. I think one was 98, one was 97, and these crazy numbers. I said, well, Doc, I'm planning a cruise with my wife, and we scheduled to leave in about a week. He said, can this wait until I get back? He looked at me, I could remember his look. He said, you need surgery now.
It's hard to tell someone who's not terribly symptomatic they would need heart surgery. It's not good news. But I remember Rickie well. He was very reserved, and what I said basically to him, if it were me or a family member of mine, I would want to get it done sooner than later. If something happened on the boat, he wouldn't be able to get the care he needs. He'd be in real trouble.
The morning that my wife took me to go to the hospital for the surgery, I came out of my bedroom and I stopped at the piano. And I played, and I cried, and I played. My wife came and put her arms around me. I think I finished the song and we left. When I got into the car, I prayed all the way to the hospital to myself, and I said, Lord, if it be your will that I pass away, let it be, because I know you're always in charge. And I accepted that, and I went in the hospital with a positive attitude, and that's where it all happened, November 13th. all about my future now. Now that I'm all patched up and I feel great. I feel like conquering the world again. The care team was just on the ball, out of sight. I recommend Ochsner to anybody. Dr. Lambert is very caring. You can tell that he's a real people person. He was there for me to take time and explain fully what the situation was. And I'm still here, I firmly believe that I would not still be here had it not been for the medical assistance that I had.
I worry about my patients, just as your family members, you always worry about them if they're at high risk. And so really, I think working together, not just with Rickie, but with the cardiologist, the whole care team, the nurse, the medical assistant, all of them, we really work together as a team to really get him the quick care and to get a bypass that saved his life. Practicing primary care to me is similar to playing jazz. And just as in jazz, the musician is listening and adapting and changing to the tune, the primary care physician is listening and adapting to the patient and really working together as a team to really make changes that are personalized for the patient.